New at 6 across the country, more than 15,000 black patients moved up the kidney transplant list in the past year. It's all following a major change made in 2023 to eliminate a racially biased test in the kidney testing equation.
When 10 TV's Kiara Lake checked on the numbers for Ohio, she found that hundreds of black people living in the state were impacted by this.
And now she's catching up with one of those Columbus patients and a doctor at Nationwide Children's Hospital to talk about this life-changing move.
Columbus resident Lorenzo Rudolph found out he had kidney disease in 2013 and is currently on the kidney transplant list.
I went through depression once over it, wishing that somebody will, donate their kidney to me.
He says the emotional toll of waiting for a kidney is mentally exhausting, but he continues to advocate for himself on social media and around the city of Columbus.
You can't just sit around and just think you're going to get one, and you can't just think your life is going to not continue.
He says if you stay in that mindset, you'll be depressed. And during an already challenging time, thousands of black patients found out because of their race, they were waiting even longer for a kidney transplant.
The whole process to me felt like it was just harder for us to be able to get one.
The equation used for kidney testing that had been used for years overestimated how well black people's kidneys were functioning.
Race is a social construct. It's not biologically based. I can't look at a person's clinical labs and determine what race they are.
Dr. Ray Bignell treats kidney conditions and is a physician advocate and chief diversity and health equity officer at Nationwide Children's Hospital.
One of the things that I think is most important for people to understand about these changes to the estimating equations for kidney function is that it's based in science.
And since the policy change was made to drop race as a factor, modifications were made for 322 black Ohioans.
The National Kidney Foundation and the American Society of Nephrology, who together developed a task force to take another look at the equations that we were using and recommended race-neutral equations that are actually better in performance algorithmically for helping to estimate kidney function.
This moved black patients up the priority list for their transplant, and Rudolph says he is now one of them.
We want to have that second chance too, just like everybody else.
Of the more than 320 Ohioans impacted, close to 100 have had a kidney transplant. But he wonders if the damage has already been done for others.
I have friends, and I have other people that I have talked to that said that they have family members that are African American that passed away because they didn't have this chance.
He says waiting for so long is what messes with him and is what he believes makes people want to give up. But Dr. Bignell hopes this policy change will encourage people to keep advocating for themselves.
Take hold of that hope. Engage with your kidney health providers. Ask them about being on the kidney transplant list.
Rudolph encourages people to look into becoming a donor to help people like him who hope to find a donor soon.
It's not going to be rough on you. Trust me. It's just you saving another life. You should feel real good and proud of yourself that you're saving another person's life.
Reporting in Columbus, Kiara Lake, 10 TV News.
All right, if you need a kidney transplant, you're not alone. Dr. Bignell says it's important to talk to your doctor about where you are on that transplant list. He also says you can explore therapies that aim to preserve your kidney function while you wait.